there's an important topic that you need to know about, and that is the topic of aromatase inhibitors. This is very rarely talked about again in a lot of circles, but the more and more of these TRT clinics that are popping up, the more you're going to hear about men that are taking these. And what I'm going to do is talk about these aromatase inhibitors today and educate you about what they do, why they are so often prescribed, and why they should not be in most cases. These are anti-estrogen medications, and these are very often in these cookie cutter types of programs. So I'm going to teach you today about why most men do not ever need them and how they can actually quickly destroy a lot of your long-term health, biomarkers, and how proper dosing of testosterone replacement therapy eliminates the need for them in the first place, but especially in this case, men. And like, my goal is to help guys that are just getting bad results, right? We're not looking to build like emotionally unstable, brittle, broken men here. We're looking to build dangerous, emotionally stable, and high-performing men with optimized hormones to save your businesses, your marriages, your physiques, your life, your health, and your longevity. So buckle up. If you're a man on TRT and you're thinking about it, and you're being given aromatase inhibitors like it's 2009, then you need to listen to this podcast. So here we go. What are aromatase inhibitors? Well, first of all, they're drugs. And you're going to hear the names of these drugs are anastrozole is the most common you're going to hear. Letrozole is the other one you're going to hear, but anastrozole is the most commonly prescribed. And they're originally designed, you probably recognize this if you know anyone who's had breast cancer and they've been given this drug post biopsy or they've been given it post surgery where they had an actual removal of their breast. So they hand these out to just completely crush your estrogen, right? So if they're if they've had cancer and this was an estrogen sensitive cancer, they would have given aromatase inhibitors to the person, to the woman. And they were never designed for healthy men on testosterone. But what they've figured out is that a lot of guys that are on, taking so this was figured out by bodybuilders a long time ago, actually, that when they were starting to take a lot of androgen hormones, what would happen is not only would their testosterone skyrocket, but also other hormones as well, other derivatives of testosterone, but also some of that excess testosterone would aromatize or turn into estrogen. And what would happen is the estrogen levels would rise to such levels that you would start to get side effects. Side effects include things like breast sensitivity or femalizing types of qualities, right? So like you start to get breast tissue developing, bitch tits, in other words. You can get really emotionally unstable, like you're on a roller coaster. But here's the thing is also your libido can start to crash. Your joints could start to feel achy and brittle. Okay, it's almost like the symptoms of low estrogen. Okay, there's a sweet spot there. So the thing is more testosterone, more estrogen, right? But with the aromatase inhibitors, the enzyme that converts testosterone into estrogen is blocked. So what happens is you get the elevations of testosterone, but less estrogen. But here's the trick, is that estrogen is not the enemy. You need estrogen as a man, not only just for life, but in your performance, your health, your longevity. You need it for optimal brain health, joint health, libido, etc. So estrogen is a very critical hormone. So not to mention cardiovascular health and mood stability. So here's the reason they get prescribed so often is that if you're giving somebody just a cookie cutter dose of testosterone, you're going to get maybe a dose on the high end. Let's say it's 200 milligrams a week. You're going to inject it Worst case scenario, you're getting a recommendation to inject it once a week. And you're going to get these sky high levels right after you inject. You're going to get these huge peaks and these huge valleys. So these big TRT spikes are also going to cause more estrogen conversion. So what they were noticing is the more spikes you have, so the less often you inject and the more you inject at once, you're going to get more of this conversion happening. So those folks are going to get prescribed an aromatase inhibitor like Arimidex, and it's going to nuke their estrogen. So it's lazy medicine, right? Because the fix clearly is to moderate and mitigate the dosage and practice precision medicine and find out what the patient actually needs to get their levels into the optimal ranges. So here's the typical cookie cutter clinic recommendation. You ready? 200 milligrams of testosterone, either a once a week injection or twice a week injection. So you're doing either 1 ml injection per week or you're doing 0.5 ml twice a week. You're going to get this anastrozole, like 0.5 milligram every 10 days, and no labs to really, check these things regular and routinely. So they're not practicing precision optimization, and it's actually, frankly, dangerous, to be practicing this blindly, right? Driving down men's estrogen, giving them, in a lot of cases, super physiological levels of testosterone, which has other fallout, which we've talked about before. Things like increases in hematocrit and hemoglobin, thickening up your blood, problems with cholesterol, driving down your HDL or your good cholesterol, driving up your bad cholesterol, and so on and so forth. So you shouldn't need them, as I mentioned before, if your testosterone dosage is dialed in. So if it's replicating, in other words, like normal physiology. So with the optimal injection frequency, the proper dosage, and you're getting routine labs to check sensitive estradiol, right? E2. So you make sure you're getting the right labs. And also, not to mention the lifestyle that coincides with optimizing your hormones. Okay, we'll talk about that in a few minutes. And it's something I talk about pretty much damn near every podcast. So in properly practiced testosterone replacement medicine, you do not need estrogen blockers, right? In the vast majority of cases, there's probably the odd case that does. So healthy aromatization is natural. It is going to happen. And believe it or not, there is a nice range that men should live in. They didn't realize that this pill they were taking every 10 days was crushing their estrogen and causing joint pain. In a lot of cases, so I also see this with women that are perimenopausal or menopausal with estrogen levels that are so low, and they get things like frozen shoulders and tendinopathies and just achy joint pain everywhere. Same thing happens with men. The other thing that happens is your libido gets smashed. All right. You have problems getting erection. You have ED. Not just like reduced desire, but actually the inability to perform. You have mood instability and irritability. And a lot of times this is blamed on like roid rage, right? Your testosterone's out of control. Well, in a lot of cases, if your estrogen is suppressed to a level where it's so low, you can no longer get the positive cognitive benefits that estrogen has on the brain, right? It modulates your mood. It brings down your irritability. And things like anxiety and depression could be symptoms of low estrogen. Cardiovascular types of symptoms like chest tightness, breathing issues, fatigue. And here's the one that is not known. And it seems pretty obvious when it comes to the women conversation, but for men who use aromatase inhibitors, it can cause bone loss. So we all know very well that osteopenia and osteoporosis is very common amongst women, especially in later ages, perimenopausal and menopausal ages when estrogen is suppressed. This happens also in men who have low estrogen, particularly that are getting chemically lowered by things like aromatase inhibitors. So not good, right? Heart attack, stroke, bone loss, all that type of stuff. No bueno. And the other one I can't emphasize enough is how estrogen is protective to your cardiovascular health, right? So what it does is it protects vessels. It supports nitric oxide production. Okay, what do you need nitric oxide for? Well, you need it to dilate blood vessels, particularly in the penis when you want to have sex and things like that. You want to have a good pump in the gym, you need estrogen. It improves lipid metabolism, right? Very important, especially when you're on testosterone replacement therapy, you have to manage and watch your lipid health. So a man with nuked estrogen, point blank, is not optimized. This is not the way to optimize someone's physiology, which is the reason they're doing this in the first place. That's right. It's totally counterintuitive. So you become fragile when you nuke your estrogen like that. So, like, here's what the symptoms feel like for a lot of guys: like dry joints, like your connective tissue feels brittle. You can actually have tears that happen, tears in your shoulders and pecs and knees. Fatigue and low energy, ED, as I mentioned. So like your morning wood suffers. You have emotional flatness. So you're just more depressive. You have terrible recovery. So you feel like you can't recover from your workouts, or you're still tired as hell in the morning. And of course, bone density loss, right? So this is not the desired effect of being on testosterone replacement therapy. Okay, because these aromatase inhibitors, which elevate your cardiovascular risk, demineralize your bone, they're actually liver toxic, cause kidney strain, can cause cognitive decline, increase all-cause mortality. That sounds just like they're aging you faster, which, this is not the goal. So my contention with properly dosed testosterone replacement and carefully monitored blood work. So you're getting precision medicine that has medical oversight, that is, practiced with care. Here's how you do this without the need for those toxic drugs. So number one is using the lowest effective dose. So again, if you're actually practicing true testosterone replacement therapy, you're getting to like optimized levels. Okay. And that depends on your age. It depends also on how you feel, right? This is why you have to do labs on a frequent basis in order to see, hey, is my dosage working? How do I look? How do I feel? How do I perform? What does my blood work look like? And that could be a dosage anywhere from 80 milligrams a week up to 200 milligrams a week. It's usually in that range. When you're overdoing it, you're going to get excess estrogen. You're going to get suppression of good cholesterol. You're going to get increases in hematocrit and hemoglobin. So really important to make sure you're dialing in that dose. Here's the other thing is not only does the dose matter, weekly dose, but also how often it is administered. So what I have observed now, and this is through like personal experience, this is with many, many men at this point who they are administering their testosterone on a more frequent basis with a smaller dose. They're getting better results with their blood work. Many of those men too, they also feel better. They don't feel that they have these peaks and valleys with their energy, their focus, their libido, their recovery. So we're talking like at least 3 injections a week, if not daily. So this is something that I'm very open about and I talk to people about. I've been practicing a microdose daily injection. And this has been an incredible change in how I've practiced the testosterone optimization therapy that I'm practicing with my results, but also with my blood chemistry. Now it sounds aggressive. It sounds like not very fun if you're needle adverse and whatnot. But what I have discovered is if you use really small gauge needles, really short ones, really thin ones, 1/2-inch needles, you can administer this in your glutes and your shoulders and your quads. You can rotate the sites, and it is so minimally, it's non-painful, and it is so minimally invasive. It's really not that big a deal once you've experienced it. Someone who has never done this before, it sounds horrific, but for those who are they are under care, getting testosterone replacement therapy, this is something I would highly encourage you to ask your doctor about. Consider switching to, whatever your optimized dose is in a week, making sure you're, spreading it out through the week as frequently as you can. Okay. If not daily, at least multiple times a week. Making sure you're monitoring your estradiol carefully, right? So you want to make sure every 3 months, in the future, once you've dialed it in, routine every 6 months, making sure you're watching that. I like to see my guys between 30 to 60 nanograms per deciliter. They're usually firing on all cylinders in that range. And making sure, and I can't emphasize this enough, to make sure you're controlling your inflammation with lifestyle. So, making sure you keep your body fat as low as you can. Body fat will encourage more of what's called the aromatization of testosterone into estrogen. So you'll have fewer issues if you have lower body fat stores. So this means making sure that you are eating quality food. I can't say this enough times on, enough podcasts. A protein focused whole food diet, right? That's got fruits and veggies, so fibers, and making sure that you're eating, calorically balanced, and you have a protein focus. Okay. Making sure you're sleeping quality. For most men, most people, most women also, that's anywhere between 7 to 9 hours a night, uninterrupted, preferably getting as many hours prior to midnight as you can. Also making sure with your movement that you're moving as much as possible, and you're also getting your strength training in, along with your occasional high intensity interval and aerobic training, and managing your stress and drinking water with some electrolyte. So you want to be making sure that you are managing in a place where you look, feel, and perform the best, wherever that is for yourself. That's where precision medicine comes into place. You're not just like chasing a number. So you're working with a practitioner that knows you, knows your history, knows your numbers, but also knows your lifestyle, right? Because like what you're not getting in a lot of cases with these cookie cutter TRT clinics that are just, doing volume, doing numbers, is you're not seeing the same practitioner every time. They don't know your history. They don't know your story. They're in a lot of cases getting incomplete labs. They're looking at your file 5 minutes before they meet with you. They don't know anything about you, right? So like, consider this is a really big deal, making sure that this is done properly. You're investing, the time and the money with somebody who, is practicing this properly with harm reduction, right? I'm big on harm reduction, making sure you're optimizing. Are you actually optimizing? Not just with how you look, feel, and perform, but also with your numbers, your risk factors. Okay. So you want to be experiencing your genetic potential, right? And not fight side effects and symptoms that are happening from, mismanaged care. So with the weaponized wellness, way, we do this with intention, with data, with care. And this is, the platform I'm speaking to you from is someone who's, the last couple of years really seen a lot of, and I'm seeing more and more people switching from these like cookie cutter, cheaper clinics to us, who take a lot more care, who have a lot more intelligence and a lot more intention about how we're practicing optimization when it comes to your hormones. Because the goal is not to just get you jacked. It's not just to like, have you look like a bodybuilder. The goal isn't to like just have you get stronger boners. Like that's all great, but you want to make sure you're doing this intelligently and playing the long game. That's what it's all about. You want to make sure that you are keeping in mind your future self, being number one, mindful of your longevity and your health. Number two, you're leaning in with lifestyle first. And with optimization, you're doing it intelligently. You're doing it with precision. You're doing it with data. And you're also doing this with somebody who knows you. So I can't emphasize that enough. So important. If you know somebody who is doing testosterone at a cookie cutter clinic and they're looking for more result or better results, or they are, tired of just getting, the cookie cutter types of results or plans. They're looking for a lot more precision, a lot more care. Share this podcast with them. Make sure you guys subscribe. I hope you like the content, and I'll keep sharing. I'll keep telling the truth if you guys keep listening. So appreciate you guys, and I'll see you guys next week.